I'm a golfer. I like to golf, and I probably golf about 40 or 50 rounds a season. I did go on I was on a golf trip the first weekend in November with some friends, a 4-day golf trip. And about 2 weeks later, 2 to 3 weeks later, I started developing pain in my back, my lower back area. The pain level was, when it first started getting bad, was probably a 7 or an 8 and would spike to a 10. My primary recommended I see a pain doctor, and he also recommended physical therapy through a hospital, traditional physical therapy that the average person would go through. And to no avail. As a matter of fact, some of the therapy they would ask me to do, when they added some, depending on what they asked me to do, would spike my pain level to 10. And the pain never subsided. In January, he gave me a shot in my spine and said it should take give it up to 2 weeks to feel relief. I felt relief for maybe a day. With the third shot, he increased the medicine, and I asked him, I said, well, how long should I wait before I would see a neurosurgeon? That was our next step, a neurosurgeon, if the pain shot didn't work. And he says, give it about 2 weeks and if it doesn't work in 2 weeks, he says it probably won't work. And I waited 3 weeks actually, and it didn't change anything. I just happened to be in my car listening to, I'll give it a plug, WGN radio in Chicago, and ProMed was advertising, and I heard the ProMed advertisement, and it resonated with me because it seemed like might address my problem, but I never heard of ProMed, so I went on the internet, researched it out, and did that, and made an appointment and talked to Dr. George Papadopoulos. And I got into the program, I think it was early May, my first session, and I was coming here 4 days a week. I limped in here, I was in pain, and the pain subsided a little bit after a few sessions. And then after about the 4th or 5th week, there was a dramatic change where the pain went down to like 2 and 3, and progressively. And I finished my 36th session, and I'm ready for my exit interview. And the pain I have is not the sharp nerve pain anymore. If I push it and I stand a little bit too long, I'll get a little tired. But I recover quickly, and it's not an issue. And I'm expecting that it'll continue to get better. And I told my primary, I said, well, you need to investigate it. I said, because it was working then, you know. So I'm very pleased.